Hello guys, welcome up to the Kelvin TV. On this episode, we're going to learn on how to administer IM medication. It's one of the major procedures in nursing that most of us find it a bit easy, but at the same time, if you don't do it well, you might make a mistake. So if you're writing your NMC or you have a practical exams, let's learn together. So before you start, you need to first check and see whether the time is due for you to administer that medication for the patient. You need to also identify the right patient, the right drug that you are supposed to do, then the route, then the time and everything that you are supposed to do for the patient. So this is my patient, Mr. Kwame Amo. Yeah, we are using a dummy. Yeah, so I need to first establish rapport with Mr. Kwame Amo, then explain my procedure to the patient. Stick and stay with me and let's go. Okay, so Mr. Kwame Amo, Bacho, good morning. My name is Amo Aji Kelvin. I'm a student nurse from Valley View University. I'm here today to administer your medication. You see, sir, when you came here, we've been giving you medication and helping you every day and then. This time it's time for me to also come and give you your medication. And this medication, you are going to take it at your butt area. Yeah, you are going to feel some pain, kakra, but you need to bear with me. Then also I'll be turning you small. So please, am I permitted to bring my staff? You have the right to reject the medication, but I will say, sir, due to the benefit of the medication, I'll be glad if you give me the opportunity or the permission to bring my staff to help you out. Okay, then thank you, Mr. Kwame. The medication that I'm going to administer to you now is diclofenac. This one is going to help you with your pain. You see, sir, you've been complaining of pain and you see the wound and stuff. So this one is going to help you. And also, you're going to feel a bit dizzy, going to feel a bit nauseated, kakra. But you see, sir, all these are some of the signs that comes with the drug, but it's not like it's going to cause any problem. But when you see, sir, it's becoming so severe, yeah, you can alert us for us to help you out. Okay, so that's what I'm going to do for you today. Okay, thank you. In IM medication or IM administering, these are the things that you need. You need your gallipot, one containing cotton swab, then the other one containing dry cotton. Yeah, then you need your medication. So these are medication. Yeah, then you need your syringes. Yeah, so these are our syringes. Then you need a needle. So after you've drawn the medication, you need a new syringe. Please, if you need it. Then you need your sharp box or safety box that you are going to put everything inside. So now we have already told Mr. that we are going to do this thing for the patient. You see, said that one we are going to do it on the patient, the butt area. So we need to make sure that we provide privacy. So guys, as I said, because we are going to use the patient, we need to provide privacy. Yeah, so we are going to provide privacy for the patient. That's one of the first things that you are supposed to do. So after we are done providing privacy for the patient, we need to bring our items closer. So these are our items. Yeah, so first we need to do the checks with the medication. So we need to take the medication, then do the checking with the treatment sheet to find out indeed the medication that you are supposed to give to the patient on one a day, man. Yeah, so you need to check. Then you check your time. Okay. So afterwards, then you will draw. So you take your syringe. So there's it. Take it like this. So you put it here and take your medication. Then you draw and check the dosage that you are supposed to, or the amount that you are supposed to give to the patient. So you do it. So please guys, mind you, this one we don't use gloves. In IM medication, we don't use gloves. You've seen many people using gloves. That's not how it is. So we don't use gloves in IM medication. So afterwards, you need to make sure that you expel the air. You expel air. Then this is how you are going to do it. Make sure that most of you hold the thing like this. If you see normally at home, but it's wrong. The thing will be here like this. Then you use the like this. Then so you throw this away in the safety box. Then you insert a new one. So this is the new one. So this is the medication. So afterwards, you need to come to the patient and catch it. Oh, mommy, oh, Mr. I. So we are ready to give you the medication, guys. Now we need to expose the area that we are going to inject the medication. Yeah, so you need to let the patient be aware. Okay, daddy, so sorry. You need to divide the gluteal into 4 parts. So you need to divide it into 4 parts. So you divide it like this into 4 parts. Then you are going to inject in the outer upper outer quadrant. Yeah, you are going to inject in the upper outer quadrant. So so now I'm doing my division. Yeah, so here I'm going to inject it here. So I need to clean that place with my cotton swab. So afterwards, I'll take my medication. And one thing that you need to know with IM medication, we go 90 degrees. So you need not to go like this. Go like this. We go 90 degrees. So now, see it all. You squeeze the place, you squeeze it like this, then you go 90. So you need to draw. You draw and see. So you draw small and see. If there's blood coming here, you need to stop. If there's no blood, then you're supposed to what? Go in. So go. Right after you are done now, quick, then you apply the dry cotton like this. Then you cork the syringe, then you dispose it. Oh, mommy, you let the patient. Oh, kafra, sorry. Sorry. Then you do like this, quick. Then you close the patient because yeah. So afterwards, then you dispose your syringe, in the safety box. Then you thank your patient. Then also let him know, if there's anything, or if he sees any signs and symptoms which is more persistent and as different from what you have already let him know, he needs to report to the next station. So after you are done injecting the medication, you need to come back 30 minutes later to come and check the patient to see whether he is stable and stuff. So you need to come and do that check. I'm done with the medication. So if you see anything or if there is anything that you need, I'm going to the next station. So anything there, you can call me. Okay, thank you. So guys, you are going to dispose your things, then you wash your hands, then you document properly. Thank you guys for watching. Keep on watching Kelvin TV. Watch out for the next episode.